Hey guys, this is Manu Kalia, physical therapist and Ayurvedic herbalist. So this is my next video on some of the knee-related problems a lot of you guys have been asking me about. And before I get into that, I want to remind you that we have our program coming up, and it's going to be launching very soon. So if you're interested, get onto the site and make sure you sign up so you're one of the first to hear about it. And as I mentioned, I'll be going to be giving out some free copies. So, and the program is on knee injuries and how to get better, how to rehab. So I'm combining both the holistic as well as the physical therapy and exercise science components together. It's going to be a pretty awesome program. We're very excited. We're on the final phase of getting the program done. All right. So the problem that I'm going to talk about today is IT band issues. So I've shot a bunch of videos in the past. I've discussed some of the treatment methods. I'm going to give you a little bit more in terms of the anatomy and what are some of the contributing factors to the problem. Okay, so let's just look at the our knee model here and let's kind of get a sense of what's happening. So this is the front of the knee. This is the side view. Your femur is the thigh bone on top. Tibia is the shin bone at the bottom. Okay, and then you have your fibula, it's that small bone that sits on the outside of your lower leg. So IT band issues or iliotibial band problems, very common in runners, cyclists, but again, it can affect anybody, with any athletes or even people in sedentary population get affected by this problem. But definitely much more common, probably the second most common knee-related issue for runners, I would say. First one was the patellofemoral pain or runner's knee or anterior knee pain that I discussed in my last video. This is probably the second most, I would say, common issue. And often the patellofemoral pain, which is the kneecap and surrounding tissues causing the problem, and the IT band issues come together often. They definitely can come together. Okay, so the IT band is that thick band that attaches to it goes along the outside of your thigh. Okay, this is that thick band that's going on the outside of my thigh. It's coming below that knee and attaching down on your tibia, on the upper part of your tibia, which is your shin bone right here. But you do have fibers also of the IT band coming and attaching on the outside of your kneecap too. And the IT band it's a thick connective tissue. It's a fascial tissue, okay, which attaches even on the bone itself, the thigh, going deeper and attaching. So it has few attachment points, and of course further up in the chain is attaching your pelvis as well as some of the local muscles through here too. Okay, so attachment sites here, it's coming on the outside of your thigh, and the most common area of pain referral is going to be outside knee pain. So generally the person will point to pain on the outside of the knee, and most often the lower part of the IT band. You can have some stuff further up by the hip too, on the outside of the hip or along the chain, but majority of the time the problem is indicated as pain is right here on the outside of the knee. Okay, can have a lot of tenderness along that region, can have some swelling, can have irritation, can have very sensitive to touch, burning sensation, so sharp pains, shooting pains. So all these things can be caused. Now it also has, underneath the IT band, you also have a fat, which is highly innervated. So a lot of compression and irritation of that fat. And some of the bursa has been indicated, which is the bursa is basically a fluid-filled sac that sits underneath the IT band as well as the bone to prevent the band from rubbing against the bone. But some of the studies show that there's not a bursa, so it is a little bit inconclusive. But nevertheless, all those structures, the IT band itself and all the surrounding tissues, the highly innervated fat underneath it, all these structures can, if there's repetitive rubbing and irritation of that tissue, can cause pain. Okay, so not only will it refer pain here, but it can sometimes radiate the outside of the upper part of the lower leg too. It primarily affects the outside knee, but then some of the fibers are attaching on the outside of that kneecap. So lateral patella pain is also not uncommon. So very often when you start digging in, you start checking the kneecap, the person can be very tense along that border too, in addition to that band that's running along the side. Okay, so treatment, of course, actually, sorry, before we get to the treatment, let's see what are the contributing factors. So some of the things are having to do with overtraining is one of the big ones, right? So repetitive strain, overtraining, which is irritating that tissue. And why is that happening? One, because you're doing more than your body or that tissue can handle. Second thing is biomechanical factors, such as alignment of the kneecap. You might have to do with hip tightness, hip weakness, resulting in change in alignment of tissues, excessive pronation or flat feet. Right? So by itself, one of these things is not the contributing factor. But when you combine all of them together, they can definitely throw the biomechanics off, the alignment off, which can cause more stress and strain on that tissue. And of course, it can get very tight after a while too, and thickened. So you have to consider that there are a lot of these factors that are affecting this problem. You know, you might be missing an ankle range of motion, you might be missing your big toe range of motion, right? So your foot, you can't bring your body over that foot, let's say when you're walking or running. So you change the alignment of that foot, the foot drifts out. You have flat feet for that matter, right? It might be changing the alignment. Because of that, you change the alignment of the knee. You get knee valgus, or the knee drift medially, or the knees drifting inwards, which is again changing the alignment of that knee in relation to the thigh, and even in relation to the pelvis, or for that matter, down to the foot. So, and further up in the chain, you might have stiffness at that hip. Maybe your hip flexors are too tight, your glutes are too weak, your gluteus medius, gluteus maximus, so they're not stabilizing the pelvis when you're walking and running. And after a while, you get fatigued, and then they're not stabilizing the pelvis in walking and running or any of those activities, and that again starts to change the alignment of the thigh in relation to the pelvis, in relation to the knee. And for that matter, anatomical differences. So wider hips, Q angle for women, a larger Q angle, have been cited as some of the contributing factors. So as I said, not one thing by itself, but multiple things combined will often result in an unfavorable environment where there's excessive work and irritation being done by that tissue. Okay. And which will set up a process where you're overstraining, right, or overworking that region, and which sets up a inflammatory process, constant irritation, sensitivity, so that then after a while, even a little bit of activity sets the thing off. Okay, so treatment has to address all those mechanical things, and then of course, remember, treat always above and below the chain to address the problem. Okay, this is getting irritated because there's something going on along the chain somewhere. So address those issues. Then of course locally also manual stuff, hands-on techniques, soft tissue mobilization, stretching that, all those tissues on the outside of that thigh. Okay, getting better alignment of that kneecap. Maybe all these tissues got so tightened up, constantly being pulled to the outside. So now you got a patellofemoral problem that's being set up too. So address those issues. So all these things have to be accounted for and addressed. Taping and correcting your foot mechanics, strengthening exercise, the flexibility exercise, all these things need to be done to get rid of that problem. So all these things need to be addressed, correcting biomechanics up and down the chain, okay, as well as treating things locally by massage or manual therapy techniques or joint mobilization, taping, and then internally taking, herbal formulas or different things that can be done to address the problem effectively. Okay, so I hope that gives you a sense of what's really going on and what's happening with this issue. and why it becomes such a chronic problem for a lot of people, and they have a really difficult time getting this under control. But it can be. You can treat it very effectively once you correct all these imbalances. Okay, and this is what I'm going to discuss I'm discussing in my program. So as I mentioned, it's going to be coming out. So make sure you keep checking the site, and I'll keep you guys posted too. And if you want to find out about it early, only one of the early ones, make sure you sign up so I can let you guys know. And I mentioned earlier in the video too that I'm going to be giving out some free copies to people. So, all right, guys, please share the video if you found this information helpful. Make sure you subscribe to the channel. And if you have a question, leave a comment. Thank you.